Republican Mike Pence from Indiana, third-ranking Republican in the House, chairman of the House Republican Conference, Representative Pence, welcome back.
Thanks, Dylan. Thanks for having me on.
So again, highlight for us the key principles. We understand, obviously, it's easy to say, listen, we want everybody to have health care, we want it to be cheap, et cetera, et cetera. What are the key mechanisms that the levers you pushed on the how?
Yeah, well, Republicans believe we listen to the American people that don't want a government takeover of health care, but they do want Congress to act to lower the cost of health insurance and lower the cost of health care in the long term. We think we do that by allowing Americans to purchase health insurance the way you buy car insurance across state lines. Also allow groups of businesses in the city and on the farm to create national insurance risk pools and buy insurance for their employees the way the major corporations can buy it today. You put in medical malpractice reforms on a nationwide basis, some nationwide caps that'll rein in some of these runaway massive lawsuits that drive defensive medicine and drive up the cost of premiums. And then you use those savings, lastly, to strengthen the existing state funds and insurance programs that cover people with pre-existing conditions. We believe we can do that all in a fiscally responsible way without mandates, bureaucracy, a government takeover, or government-run insurance.
Yeah. Why does everybody's model, whoever it may be, when they come up with a health care plan, it still ultimately rests on the decisions about my health care, the decisions about Nate's health care, your health care representative, whoever it may be, being made by a CEO of an organization, a consortium, a company, whatever it is, as opposed to the liberation of all of us individually to go to a marketplace like we do for car insurance to buy it for? Why is there so much of a hesitation to flip from basically the employer system, the consortium system, to a real liberalization for all of us to buy health insurance?
Yeah, I'm not sure I really know the answer to that. I've debated colleagues in this on the airwaves and on the floor and in private over it. There's a lot of talk about, if you allowed Americans to purchase health insurance as individuals or businesses across state lines, that I've heard the word race to the bottom. But, I think with the extraordinary increase in the cost of health insurance premiums, there's a lot of Americans, a lot of small businesses out there that would like to race to the bottom of costs. And I think that's the fundamental difference between the approach of the Democratic majority in the White House and the Republicans' approach. They're launching this massive expansion of government bureaucracy, taxes and mandates to achieve what they call universal coverage, which it is their every right to pursue. We believe the American people are most concerned about the cost of health insurance, the cost of health care, and so our plans are designed to bring down the cost using the power of the individual, as you described.
But it's very telling that you yourself would agree, in public or in private, with somebody like myself, or imagine anybody else who just believes in, again, personal choice and free markets, and yet the political body, it does not feel comfortable basically removing the power that currently rests in the executive suites of corporations, the power that rests in the executive suites of large union leaders, the power that exists in executive suites of other organizations, because they would lose power, and at the same time, you would lose the ability to exact more profitability through a private negotiation between a large organization CEO and a monopoly insurance company. Isn't the role of government to break that monopoly and to stop the backroom deals so that we all get cheaper insurance? Modern technology stunningly allows us that opportunity. It seems government's the only barrier now.
Yeah, right. And you got them in there at the end, the insurance companies, and state governments. We've had over the last 100 years, state governments and legislatures control what insurance is offered. They regulate the insurance within those individual states, and they provide a barrier. I mean, it really is odd to think that somebody that lives across the river in New Jersey can't go online or pick up the phone and call an insurance company in New York City and buy insurance there. A big corporation can, but an individual can't. We really do believe, I want to give the president a little bit of rhetorical credit here. From very early on, President Obama has said we need to bring competition into the system and more choice. Well, Republican, our proposal and the bill that there's a one-page summary online right now. We'll have our bill out online in the coming hours, Dylan, for people to look at it line by line. But our bill really is about that idea, not with a so-called government-run insurance option or bureaucracy, but allow more competition between the 1,300 insurance companies that exist today across the country.
Very quickly, because I do have to wrap this up, but why, I've had this conversation over and over, 10 different ways, 10 different people. I don't understand why somebody like yourself, who has a very clear head about markets, competition, and understands how government can prevent those forces from being brought to bear to protect monopolies, to protect artificial profit margins. Someone like, again, Ron Wyden, who's a Democrat, believes the same thing, and yet I feel like the Republicans and Democrats are still playing Red Sox Yankees because that's what Republicans and Democrats do, and a Red Sox can't line up with a Yankee even if they both agree that everybody in America, your words are not that much different rhetorically than some center Democrats, and yet we have yet to see a press conference with you and Ron Wyden or somebody who thinks like you and thinks like Ron Wyden saying, listen, enough. A government is a barrier to competition through antitrust and a bunch of outdated rules that are protecting insurance companies and big CEOs and big corporations at the expense of the American people and our health care.
Yeah, Dylan, and I'll tell you what, I welcome that. You know, I was here on September the 11th. I was here on September the 11th. I want to tell you, some people might think what you just described is not possible in Congress. But remember those months after 9/11. There were no Republicans, no Democrats in Washington. There were just Americans. We came together. We worked in the national interest. Well, you know, my hope is, and I know all politics is local, and Virginia and New Jersey residents made those decisions on their own yesterday. But my hope is that the decisive turn, particularly with independents, in the last 12 months in those two states is going to create the kind of dialogue, the kind of opportunity for bipartisan compromise that focuses not on growing government, but on lowering the cost of health insurance, and Republicans are ready to do that.
Love the rhetoric, and again, if you can manage to deliver any sort of message that is not a Red Sox Yankees message, but is a pro-taxpayer message out of Washington, D.C., because health care is not a Red Sox Yankees issue, neither is bank reform, and yet we're playing a lot of Red Sox Yankees with things that all baseball fans would like to see, if you'll let me complete my metaphor. Representative Pence, thank you so much. Please come back soon.